Well, TiNivo-2 was presented for the first time here at ESMO 2024 in beautiful Barcelona. It was a phase 3 study to address an important question in immunology and in the field of immune checkpoint inhibitor in renal cell cancer, but I believe it applies to other solid tumor, with a re-challenge with a PD-1, PD-L1 inhibitor after prior progression on PD-1, PD-L1 inhibitor has merit. We see the practice all over the world is folks, in many occasions, even after progression, they keep that checkpoint inhibitor going with each regimen. We had a study last year with atezolizumab, and the control arm was cabozantinib. So that CONTACT-3, and it was really negative for all the primary endpoint. But here, TiNivo-2 addressed the same question, but was two major differences. One is that we did not use a PD-L1 inhibitor, we used a PD-1 inhibitor, nivolumab. And second, the patient, 1/3 of patients, their last drug was not a PD-1 inhibitor. So patients were randomized to tivozanib versus tivozanib plus nivolumab. And after a median follow-up close to a year, the progression-free survival was not significant in either arm. The hazard ratio was over 1. Of note, the dose of tivozanib was lower in the combination because of the risk of grade 3-4 hypertension. The toxicity was similar. Not just the progression-free survival endpoint was not met, but neither the response rate, similar in both arms, or the overall survival. So this is the second phase 3 trial. I would say in solid tumor, but here let's focus on renal cell cancer, that asked that question of re-challenge after prior progression, and it's dead negative. I think this practice in general should be discouraged, and heavily discouraged. There are some exceptions, but in general it should be discouraged.